We're United Hospital Center, one of the region's most respected medical centers since 1970. We are a collection of compassionate people with boundless emotional support and unconditional devotion. We combine the science of medicine and the generosity of the human heart to deliver world-class care for more than 100,000 residents of North Central West Virginia. And we are home to the Cecil B. Highland Jr. and Barbara B. Highland Cancer Center, a fully accredited, comprehensive community cancer program. With the quiet yet generous help of the Highland family, the Cancer Center at UHC provides the entire continuum of cancer-related services in a single location that is designed for patient comfort and accessibility. United Hospital Center is a magnet for the hearts and hands that make a difference. People who thrive on the purpose of contributing to life, where high country and mirrored lakes are gifts that we call almost heaven, near forests that have never seen a road. Medical progress is taking shape for future generations. Today, the future of healthcare is here.
I'm Linda Cart, Director of Oncology here at UHC's Cancer Center.
And I'm Dr. Jeff Madden, a general surgeon and cancer liaison physician. If there's one point I want you to take away from this video, it's the fact that UHC offers a multidisciplinary approach to cancer treatment. What that means for you is that we have teams of experts that will come together to formulate the best treatment plan for your cancer. All aspects of cancer care that a patient may require are available at UHC. This starts with early detection and screening and may progress to surgery, medical and radiation oncology, inpatient and outpatient treatment, home care, and when appropriate, hospice. United Hospital Center has been recognized by the American College of Surgeons Commission on Cancer as a comprehensive community cancer program. What that means is that our patients have access to the latest cancer protocols and experimental treatments maybe not yet released by the Food and Drug Administration.
At UHC, we're also here to help you with the emotions brought on by cancer, your shock and disbelief, your fears and tears, and your anger. These are not only very real, they're also very common experiences after the diagnosis. You're not in this alone. We are here for you and your family every step of the way.
In January of 2012, I had my annual yearly mammogram. A few weeks later, I received a card in the mail requesting that I come for additional films. When I did, I was referred to a surgeon. When I talked to my surgeon, he told me that my mammogram was a class 4 and that I had an 80% chance of everything being okay. When I walked into his office in March of 2013 after having had surgery, he told me that I had invasive breast cancer. My world turned totally gray. The color was gone from everything. All I could think about was what's going to happen to my mother, because at the time I was also taking care of her. And what about my daughter in Chicago? I was terribly worried and didn't know which way to turn.
And this is where I come in. I'm Peggy Johnson, registered nurse, clinical navigator for United Hospital Center. I've been in this position since March of 2012, and one of the main purposes of my position is to see the breast cancer patient through their cancer journey. The clinical navigator for breast health encompasses a lot of different responsibilities. One of them is to get the education out to the community about prevention and early detection of breast cancer. Another thing would be to be with the patient through pre-diagnosis, and if there is a malignancy, to see them through education, resources, and the cancer journey. I am the advocate, the liaison, the educator, and the friend. In time of fear and anxiety, those can be barriers to not getting the health care that is needed. We want to relieve the fear and the anxiety for the patient. We want them to get the right treatment at the right time by the right person.
In December 2006, I went to have a knee surgery done, and everything was good. I had no pain, no nothing except for the knee. I was taking medication for the knee, and I assumed that I went to the restroom and seen some blood in my stool, so I just assumed it was something to do with the knee. With further investigation, we did a colonoscopy, and I found out that I had stage 4 colon cancer. After a series of surgeries, I come back to United Hospital Center to have my treatments done here, the chemo in the infusion center, and the staff, Dr. Osmond, a great bunch of people to have around, very encouraging, very uplifting. To me, the best advice I could give to anybody diagnosed with cancer is to research it. Find out everything you can about it. In my situation where I was at, I was cancer illiterate. I didn't know nothing about it. I just, you heard the word cancer and you think, well, I hope they get better. But when it struck home to me, then I had to really go find out what was the best for me. 5 years later, and I'm still here, and I feel better today than I ever did in my life. And, things are going great.
This video will prepare you for your next step in your journey with us at UHC's Cancer Center. With the click of a mouse, you can learn more about cancer and various cancer treatment options, including surgery, chemotherapy, and radiation.
We'll discuss with you the importance of good communication with your doctors and various pain management techniques. Plus, we'll prepare you to fight fatigue while you're undergoing treatment, give you some advanced planning ideas, eating tips, show you how you can get involved with a variety of support groups, and provide you with a tour of the facility.
Thank you for choosing the Cecil B. Highland Jr. and Barbara B. Highland Cancer Center at UHC.